Tonight, the United States extends its travel ban to the UK and Ireland. Spain is locking down whilst France is stepping up its restrictions too. Good evening, welcome to CoronaBeat once again here on Force 13, another special production as the virus, the pandemic, continues to escalate around the globe. My name's Nathan Foy, and this is not the usual kind of coverage that we do. We still maintain that it is incredibly important that we do put our side forward here on the air tonight with the latest update. We've started earlier than we have the last two nights because obviously we acknowledge that the main, or indeed the World Health Organization said the other day that the epicenter now is within Europe, and that's quite clear in the last day or two as cases have really spiked in the European continent, particularly Western Europe, in the last day or two. Italy, France, Spain, Germany, all soaring in numbers right now, and a lot of European countries locking down. Poland, the Czech Republic, Slovakia, Norway closing its ports and airports very soon. Spain looks like it's going to shut down, and France is closing all non-essential public services starting tonight. That news broke just over an hour ago. Well, joining me tonight again is my team, which is consisting of several people on this occasion. Some of the regular faces. First of all, David, hello. Oh, maybe David's not there. David is in the wings somewhere. Have I? Hold on a minute. I've not even turned everyone on. Okay, that went well. David, hello.
Hi, Nathan. The technical issue. I was wondering if I had the wrong headset on because I'm streaming onto the Facebook page and operating another computer and.
We are live again on YouTube and Facebook tonight.
Yes.
And we'll talk to you a little bit about what's going on over there in a little while. We're also joined again by Parker. Hello.
Hello. Hi.
And you're showing us a map there right now, the latest in Europe.
Yeah, so as you can see, you'll see in Italy, some of these in France, some of these big bubbles starting to really spike in over the past couple of hours. Yesterday, I was looking at this. These were not that big, over the past, 48 hours, cases have been spiking. It's actually pretty interesting seeing, mainly right in this region right here, all these cases you can see spiking. It'll be interesting to see what happens in the coming days, if they will continue to spike or if they will dip down again. But until then, mainly we just gotta, listen and keep watch for what France and Italy are doing. If they're how long they're going to shut down, or how long they're going to put in a state of emergency.
That's right. Tonight we're also joined by Kenneth, who is one of the first people to join us from outside the UK or US. So it's nice to have you. You're in Hong Kong this morning.
Yes. Hello, guys. It's my first live ever.
Yes. Welcome.
In Hong Kong, it's 142 now. Asians new cases are just dropping, but Europe seems having a very rapid rise. More than 33% every day, which is really bad.
That's right.
Yeah.
If you've got any comments or questions for us whilst we're on the air tonight, please send us a message live on YouTube or, of course, on our Facebook stream. David will pick them up there as well. I'm just trying to find my running order. I've completely lost it, so I have no idea when my schedule here. So I have no idea what's going on tonight. Obviously, we'll deliver the news as best we can. So today, so far, I think we're talking something like another 5,600 cases, which seems a little low. I'm sure it's going to be more than that. Italy today having another new high today. over 3,000 I think 3,400 new cases in Italy today, bringing the total number to 21,000. As well as France and Germany, over 800 each. Spain, I think, might be 1,000 today. Their number is now at 6,313. The death toll, they're nearing 200. Spain in a bad way right now. And of course, Iran, another hotspot. 611 dead now in Iran. So I don't know who wants to start, but if you want to tell us about what's going on in your neck of the woods, maybe Parker?
Yes, I will actually. Just today, around 9 or 10 a.m., a person in Wells County had tested positive for the coronavirus, which is a county just right next to mine, see Grant. And so that makes a total of positive 15 cases. We also had another total positive case in LaPorte, as you see, right next to St. Joseph. So probably in around some of these counties, they are probably this isn't confirmed case, but there might be more cases in and around these counties, which hopefully there isn't, but there might be. And as you see, let's go to county lists. As you can see, 1 in Adams, 1 in Boone, 2 in Hendricks, 1 in Johnson. There's 3 in Johnson County, LaPorte 1 county, Marion County 3, Noble County 1, St. Joseph 1, and Wells 1. So those are the current cases. And by Eric Holcomb, we said earlier, is that they are expected to rise probably very high very soon.
What's the what's the worst affected state at the moment?
Worst affected state would most likely be Washington, as they've had it's still spiking in some cases and
really?
Lots of new deaths recently.
Well, that's of course.
But New York also had
generally where it started in the US, isn't it?
Yep.
But obviously, you're looking towards those big population centers, New York and California, by the sounds of things. A few other places. Yeah, all right. But overall, over 1,500 cases now in the US. No, it's way more than that. It's about 2,500 now.
Yeah, they're probably pushing 2,500, if not 2,600 by either late tomorrow or tomorrow morning.
All right.
So,
David, any news out of Australia this morning?
The effects of the ban on the mass gatherings, and I think it starts in 24 hours, is throwing the nation's arts and entertainment industry in the turmoil, with casual workers especially devastated. The federal government will ban all gatherings of more than 500 people to be suspended, as I said, from Monday. Concerts, theatre productions, comedy festivals, flower shows are among the growing list of cancellations across Australia.
Yeah.
So it's the domino effect. But Nathan, we've got to have in place a breather. And
we've still got this argument at the moment, though, David. You know, is it right that everywhere is going into lockdown before the height of the epidemic in each country, or the UK, which has been one of the countries, one of very few, if any, that have sort of not rejected that, but said it's too early. We want to wait until we get closer to the peak before we start closing down everything. And they say that because they don't think that people will heed the instruction, as it would be, to remain indoors for weeks at a time.
Well, the federal opposition over here, they've really been sticking the boot into the federal government, their response nationally. And there'll be another special meeting of the cabinet, the Prime Minister, and all the state territory leaders are to meet regularly. And Prime Minister Scott Morrison on, I think it was Thursday or Friday, Friday they had this regular heads of government meeting, and apparently all the premiers are on board that they will meet regularly with the Prime Minister, planning and how they're going to respond. But I know that over here it is worsening. We haven't reached the peak, and you raise a valid question about the peak, but we've got to try and slow down the spread. But people are catching it, and they haven't even been outside the country. It is highly contagious. We're seeing this over in other countries. And as I mentioned in our stream yesterday, a chap arrived back in Auckland on Thursday. He went to the doctor. He was confirmed with it. And he came from Houston and another stop over there in the States. So
all right.
I have no doubt that it hasn't peaked, and we don't know when it's going to peak. And I'll be phoning the local hospital tomorrow to try and get a bit of an update. And
Parker,
you just got to avoid crowds.
Just let people know what website you're using there.
This is actually one that Strat gave me, and it's Johns Hopkins University, as you see up at the top. Very good. They really do a good job keeping this updated almost every good 15 minutes to an hour. They keep this website up. As you see down there, they have a number of regions or countries that have it. They have the total confirmed case, which have actually just been updated just when the stream started. So, if Nathan ever gives me numbers,
that means our numbers will be out of date.
Yeah.
We're going to show some numbers shortly. But, you know, the numbers are getting less relevant as time goes on, aren't they, really?
Sure. Yes, exactly. That is true. But, yeah, it shows the actual cases down here in the logarithmic, as you see, and the daily case, new and new recovered. So it's a pretty helpful website if anyone wants to go and check. It's this Johns Hopkins University Coronavirus Global Cases by Center of Systems Science and Engineering at Johns Hopkins University. So yeah, that's what better music. Thanks to Strat.
So there it is, and Strat's not here tonight. I think is he in transit right now?
Probably, yes.
He's in transit at some point today. Well, we're going to show you what's been going on in some of our selected locations around the world today. Another serious day out there, and here they are. Cases have risen to over 1,000 in Norway, and airports and ports will now close starting this Monday. In Japan, cases are still steadily increasing with over 800 now. Schools remain closed. The Prime Minister announces that the 2020 Olympics is still expected to go ahead. Doctors and nurses from Wuhan have reached Italy, the capital Rome, where the cases are still significantly rising across the country. A new high in cases today with over 3,000. France, another country that's suffering at the moment with nearly 4,500 cases, has decided to shut down all non-essential public places starting tonight. And if you have your own story locally or regionally about the coronavirus, send us a message on any of our mediums and we'll put it to air. Facebook, Twitter, and through email at contact@force13.com. Yes, welcome back. This is CoronaBeat live on Force 13 here again. Special coverage continuing at this point. Now, I wonder if obviously one of the top stories today is that the United States has extended its travel ban to cover not just the European Union, but also the UK and Ireland, which was somehow exempted last time as well. I don't know if anyone's got any comments on that at this point.
I do, and this is the president was tweeting this earlier. I think one of the reasoning behind this was because since I don't know Nathan, if you can back on this, but with the I think UK case is now up to almost 1,148. I think once it reached that 1,000 mark not too long ago, I think that's when you kind of pull a plug and say, oh yeah, I'm probably going to extend to these countries just so they can even get knock down that risk for anyone flying in from United Kingdom and having it. So I think that might be one of the bigger, if not bigger, reasons why he did that. So I don't know if you have anything to back with that as well or say about that as well. So.
Oh, I'm not sure really. I mean, well, you look around the world by this point. I'm not really sure how effective shutting down borders and banning travel is going to be. A lot of European countries are doing that as well. Completely sealing off their borders, as I said earlier. Poland, the Czech Republic, Slovakia, I think it was. Norway closing its ports and airports, as we saw in that short clip there. So a lot of different actions are being taken by the countries out there, and I guess people are treating it with different amounts of severity.
But for Europe, really, Schengen Agreement is something that is pretty trouble. That countries are limited, like border quarantine, stuff like that. The flow of people cannot be. You can't limit by border quarantine because of Schengen Agreement. That is start from Italy to the entire Europe.
Yeah, it's a bit of a mess right now, isn't it? Obviously, people at the European Union suggesting that the borders shouldn't be closed. I think there's quite obvious reasons on that there, because that's what they're all about, keeping borders open, free travel, and all of that. But Hong Kong, obviously, in the news quite a lot in recent times. How have they been with travel restrictions? And also, in such a... it's one of those very high volume population density areas, of course. So with over 100 cases there in Hong Kong now, what's the advice? Are people staying indoors?
Actually, because we do have experience of SARS 17 years ago, it's not very long time. We did learn a lesson from that. Currently, travel restrictions on Egypt, Iran, Japan, Hokkaido, Korea, and Schengen countries were having. If someone come to Hong Kong, they will be sent to Schengen quarantine for 14 days. But
and a lot of countries are doing that as well. Yeah.
But for me to say, the government is not doing something pretty at all. Yeah. The government is not doing something pretty firm at the beginning when China having a very serious outbreak in January, like close the border to ban all immigration in China.
Okay.
Because of that, let's start it from February.
Yeah.
That's
when the biggest part of the outbreak was.
Right. Having a strike in early February.
I think I remember seeing that, yeah.
Yeah. Actually, the credibility of our government is very, very low since last year, June, the protests in Hong Kong, which is, already grow very discontent towards the government and police force.
Yeah. So a bit of an uncertain future there then, I guess.
Yeah. Yeah, and even now the disease is currently now actually why Hong Kong just 100 something cases pretty low, right? But actually, well, because we do not trust the government, we do not trust China, we protect ourselves.
All right. Well,
We
let's
do
try not
measure
to
to
get
protect
too
ourselves.
political about this.
Yeah.
But let's move over to Parker.
Yeah.
You're showing us something right now as well.
Yeah, so this is actually from my father earlier. He made a pretty, I think it was pretty valid point for him being a nurse. Um, he's kind of crunching some numbers earlier, and he made a good point where most of the supposed COVID-19 deaths were surprisingly in the 30s and 40s, with hypertension the leading comorbid, heart disease second, diabetes third, and older individuals with these or two of these comorbidities, of course, were easily affected as well.
That's interesting.
Hill says I was.
Can I just stop you there because
Yeah.
they I'm sure the statistics that we've seen so far is there's only a 0.2% death rate all the way up to age 50. So is that showing some doubt to that?
Yes, because he made a good point to me earlier as well, is that some of these agencies have been forgetting some key points, and that granted, yes, it may be affecting people with older ages, but as well people with these pre-existing conditions that are younger as well, and with everyone always fear mongering, and not necessarily fear mongering, but everyone going out panic buying and hypertension. That is causing a big increase with coughing and eventually weakening the immune system, and then pretty much don't want to say this, but killing them off. And that is what no one has really noticed, is that some of these younger ages as well, it is starting to come down to these younger ages, and I think so stuff like that. But continuing on, he said at first there wasn't, and they had to be developed only 3 months ago for thousands of people, and that were the test kits. Um, and he said prior to the first cases in China, there was still a raging flu season that began late August there, with people positive for flu A or B, in some cases A and B. This season as well, with both,
I mean,
there have been
what's
mostly
basically
respiratory
being
symptoms.
said there, Parker, is questions as to whether the tests are stringent enough, accurate enough, because they've been rushed through.
Yeah.
That, and he also said later on is that some of these tests might have been inaccurate in pointing out to some of the flu deaths as well, because he made a good point that some of the flu, influenza B, some of the symptoms are really, really close in with the coronavirus. So that could have been a bit of a tipping point where people may have kind of switched up with some of the numbers there. And he made a good point that some of that might have been kind of mixed up with the coronavirus death numbers as well in China. So with that, probably led to some confusion, and led to maybe some deaths that weren't actually coronavirus related, and maybe influenza B.
Okay then. Anything else, David, at this point?
I'd like to pick up on what's just been said, and I particularly note hypertension there, and the age bracket 30 to 40. I'm just reading a document put out by our federal health people or department. Direct close contact with a person while they are infectious, or in the 24 hours before their symptoms appeared. Close contact with a person with a confirmed infection who coughs or sneezes, touches objects or surfaces such as door handles or tables contaminated from a cough. And it's definitely...
It's going to be impossible to stop that kind of thing, David. And what we did, I don't know if this has been confirmed or not, but what some tests have been saying is that it remains airborne for 3 hours, and that it can remain on surfaces for 3 days.
Yep. my father, they actually had to talk about that in a meeting at their hospital because the CDC had updated them. I guess all hospitals around the world that is able to now stay airborne for 3 hours and stay on services for 3 days. So they have to continue and regularly clean, frequently touch places, and pretty much make sure every place is either clean or sprayed with different types of air disinfectants or whatnot. So yeah, that is probably some truth to that as well.
One concern that I've got is, and I thought of this quite a few days ago, air conditioning units. Are we going to see the air filters cleaned regularly? Because we know that air conditioning isn't healthy. And Nathan, just quickly on the out of this document by the Federal Health over here, fever, sore throat, cough, fatigue, difficulty in breathing.
Yeah. And of course those are the common symptoms indeed, if you've got any of those. And just another note, I think if you've got a thermometer handy, I think it's always good to check your temperature at least once a day. And what the general advice is...
anything over 82.
Yes.
Yep.
And wear a mask, very important. Every day when you go out.
But what concerns me, and I forgot to mention this, the testing. Now, if it's a viral flu, you're basically just testing for bacteria.
Yeah.
So
I just want to say
you
as
can
well,
have testing and it won't show up anything
true.
unless it's a bacteria.
I just want to say as well, at least here in the UK, and it's probably advisable everywhere else, what they're saying, I think, is that if you do register a temperature of over 37.8 Celsius, which must be about 100 Fahrenheit, then to self-isolate for at least 7 days. And if you're at a point of illness where you would normally go and see a doctor, that's the point where you ring the non-emergency line 111 here in the UK, and take it from there. They'll probably ask you, or they'll actually now here in the UK in one or two places, even locally, they're starting to open drive-through tests. And I know some of those are happening in the US as well, because I think it's Tim operating the US handle tonight. I think just said something about... Oh, is it? No, it's someone else, sorry. In Houston, they're putting up drive-through testing sites in malls. So that was one of our comments. And please send us updates on the chat section as we go along this stream tonight, and on Facebook. But the US handle just posting some stuff there as well. New presumed case in Brunswick County, North Carolina, and flew into Wilmington Airport. And Wake Johnston County schools are closed as a teacher has been confirmed contracting the virus. And apparently Apple has closed all stores outside of China.
Yep. And I'll make a quick point right now, too. This is as of 7 p.m. At Nathan's area in 20 UTC. And so far there's, I'd say, out of right now, new confirmed cases is 9.1, which over the past, at least from the beginning of February, is probably the third biggest in new confirmed cases. So that was a bit interesting. Probably most of those being in areas like France and in Italy. So that's probably the third highest confirmed since probably the beginning of February we've had.
When was that, sorry?
This is as of today, right now, around 30 minutes ago. The report came out and they said 9.1 thousand new confirmed cases. That probably most of those being in
Well, according to the World Health Organization, the number of confirmed cases yesterday, March 13th, was 11,600, and that is the second highest after February 13th, which reported 15,200. But I think that was a technicality on that one as well, so you could say that the one yesterday was the biggest spike. I assume the data hasn't come in fully for today because, the 14th of March hasn't finished yet. But that's where we're at right now. Well, we're going to take a break here for a while, and then we'll talk more about, I guess, the social impacts after this. During this special coverage, we'd like to hear from you and the situation in your area. Send images, video, or audio recordings to contact@force13.com, and we'll put them to air. Force 13 Live, latest on the coronavirus, on our special coverage once again, another hour here that we are bringing to you live with the very latest, and more countries that are closing down to various degrees. Spain looks like it's going to be on a complete lockdown very soon. France closing all non-essential public places. Italy, of course, has been on lockdown for a while already. Norway closing its ports and airports. The United States extending its travel ban to the UK and Ireland, and several other countries doing their own activities too. My name's Nathan Foy for the second half of this coverage tonight on our latest episode. And I guess we want to talk a little bit more about the social impacts of what's going on, and Parker's got something to show us, I believe.
Yep, and this was actually earlier when I was at a Sam's Club near my area, and some of these shelves, real quick, I'll show. They're around maybe 10, 15 feet high, and they were almost completely empty, as I'll show the video right here, showing it. I mean, the kind of like foil type products, but most of the paper, napkins were completely gone. I mean, the only kind of real thing that was there was a couple of plastic stuff. But other than that, most of the paper type products were gone. A lot of baby clothes were gone. A lot of that kind of stuff was gone. There were a couple things of like laundry detergent, but laundry detergent was gone. I mean, it was surprising to see all the stuff gone. When we got there were only 2 cases of water left between like a big, good 15-foot long area where there usually is a 10 feet high of probably water cases. Those were all gone. There was only a good maybe 2-4 cases left when we got back there. So
it's mad, isn't it? People are going completely crazy. And it's not one of these natural disasters that, like a hurricane is on the way 3 or 4 days out and it's going to come. And so, people raid the stores and do all of that. But this is going to roll on for quite a while in some places, weeks. And it's a problem. Places, I mean, you would assume that places are going to continue to get restocked in most areas unless the workforce completely comes down with the virus.
Exactly.
But I don't really understand why people are... And there are some cases, especially here, I don't know about over in the US or in other places, but people taking not just enough for them, but enough to stockpile themselves for a very long time. Yeah. I think there was a case in Australia, wasn't there, David, about that?
Yes, quite a few people are stockpiling. The major supermarkets restricting purchasing. But Nathan, whilst I've got the microphone, the governor for North Carolina has issued a executive order to stop mass gatherings of more than 100.
Yeah,
okay.
That's a big difference compared to over here. Anything over 500. And
yeah, places are alternating between 100 and 500. It's it's just one of these numbers, really, isn't it? I don't think there's much difference between them. From what I heard one of the UK professionals say is that an infected person tends to infect 2 or 3 other people around them. I'm not sure how much there is in that, but that was one of their... I didn't really understand all of that press conference that happened the other day, but they're still... Yeah. Not officially shutting down public events here. A lot of individual organizations have taken action upon themselves, and a lot of places have done that, and even smaller gatherings have also been pulled. There's some small meetings that I was supposed to attend in the next week or so that have been cancelled. There's only going to be around 10 to 20 in attendance. So interesting to see how different people are reacting to this.
I just saw Force in U.S. Just said supermarkets such as Publix and Harris Teeter are closing early to sanitize their stores and Most Publix are closing at 8 p.m. Harris Teeter at 9 p.m. respectively. So that is interesting. I noticed that some of our places here in our county are not doing that.
And my goodness,
so
all those people panic buying at supermarkets, they're not even thinking about what they're doing. You know, if they've got the virus undetected, then everyone's crowding around in the supermarkets trying to grab stuff, then that ain't going to be a good situation.
That's very true.
Exactly.
Wow. And they're not thinking about those that can't get into the stores. And then just the greediness and all that,
but then you don't always know. They might be grabbing. You'd like to think that if anything, they're grabbing loads of toilet roll or whatever they're getting to give to those older people who can't get there and those who are isolated and vulnerable. But I guarantee that's not always the case, or even maybe half the time.
No, so I think it's multiple packages of the.
Yeah.
And
and then you've got the stores.
She was abused.
Oh yeah, that can't be good. But you know, a lot of stores now are limiting the amounts of products you can buy. But you know that is a valid point. If you do have 8 children, or you've got a huge family, or whatever, you know, they might be hit by some of those restrictions too. I guess that's more rare than the people who are buying, you know, loads of pasta and toilet rolls and hand sanitizers for themselves. But there we are.
On getting in.
Yeah, what are we looking at? We're looking at an empty shelf.
Sorry. Yeah. So this was sent from Tanya earlier today. She was in a Dollar Tree, if I remember, and this is looking at a shelf full of toilet paper that is completely gone, and I'm working on getting a different image that she sent in as well.
So that's over in Pennsylvania. I'd like to know, anyone out there in the US or in the UK, is there anywhere that actually has toilet paper in right now? I'm not going to encourage people to flood down to that store, but I'd just like to know if anywhere out there hasn't sold out due to panic buying. And there it is, limiting to 4 at that store there.
Yeah, this is disinfectant and other wipes and stuff, as you see, completely gone. Actually, you can still see on the side over here some looks to be hand soap, which at the store I was at earlier, they were completely out of hand soap. So that was pretty interesting seeing that as well, which you wouldn't really expect that for a store.
Well, they keep saying normal bars of soap are just as good, though.
Exactly. I don't. I mean,
there's something I'll have to check too when I go to the shop. But Nathan, for our viewers, considering my age, and I said this to a couple of staff in the local food retail shop, all the years I have never seen, coming into this store, I have never seen so many vacant shelves.
It's a media frenzy, especially toilet paper, as well as everything else. It's a media frenzy right now.
Really
this event,
back off.
And I want to keep pointing this out. This event has a bigger media footprint than any natural disaster that has occurred in the 21st century by at least 4 times. Really? The next highest was the 2004 Indian Ocean tsunami, which killed about nearly 300,000 people. And is only had 24% of the reach as this does today. And obviously you could say it's a different time frame, but hey, look back at Hurricane Dorian last year. That was the biggest, probably one of the biggest natural disasters of the year. This thing is 10 times bigger than that already. The Japanese tsunami in 2011, it is 11 times bigger than that in media footprint. It's ridiculous right now.
It is. And I'm waiting to see what our federal government is from the federal opposition yesterday. But the special cabinet, it's not a wartime cabinet, see what comes out of their meeting later today.
All right, we're going to take another short break here. After this, we'll take your questions. Start your message with Force13 all in text if you'd like to get in touch on our YouTube chat. And you can send your questions in through Facebook as well. We're back in a moment. We will continue to run regular updates on this feature. Send us a message on social media if you wish to be involved in our coverage or to join us on our panel nightly. Send us a message through Facebook, Twitter, or our contact email address, contact@force13.com. Welcome back. This is Force 13 Live, latest on the coronavirus, which we don't really want to bring to you, but obviously the situation is so large around the world that even, us, obviously it's not really our area, but we are covering this the best we can because we've got to push our version of events out there too, and hopefully we're doing a good job of that. Thanks for tuning in again, and we'll take some questions if you want to send them in. Start your message with Force 13 all in text, and we'll see where we end up, I suppose. And you can also send in your questions on Facebook Live as well, which is where we're also streaming right now, thanks to David. Are there any questions there right now, David?
No, I've got nothing from the viewers on Facebook, but we appreciate the support. However, Nathan, one of my main concerns is the massive, how this virus has been transmitted, the massive international air traffic movement, and are we going to see more flights grounded to try and prevent?
Yeah,
well,
I was
it's
looking,
like closing the gate.
I was looking at the flight patterns today. Interesting patterns around right now. A lot of areas are only a little bit lighter. Of course, over Italy, it's very, very light right now. I did notice one flight that was headed from Frankfurt to Iran earlier today had landed in Italy, in Pescara. I'm not sure exactly why. One of our server participants suggested that it might be to deliver supplies. I don't know. But that was an interesting little snippet there. Parker, you're showing us this. Is it a cold or flu? And I suppose we might want to examine this a little bit further to put coronavirus into this as well.
I know it's a bit kind of off track if you want to say it, but yes. So signs and symptoms, which you can see, some of these closer with fever, maybe sneezing, stuffy nose, chlorophyll, or chest discomfort or cough. Some of those are probably can be, if you want to call it, can be related with the coronavirus. But I was just kind of want to make point of that it's what's going to be hard to tell is that some of these cases, it's not cases, some of these symptoms are really close to flu, and some people might kind of. I'm afraid
Let's
they
just
might
go through
either,
those flu ones, because a lot of those will be indicative of coronavirus. Symptom onset will be abrupt in most cases. Fever definitely will be there. Aches will probably be there. Chills have been reported by quite a few people who have had the virus. Fatigue and weakness, can't rule that out either. and then you're looking at those other ones there, which are, you know, here and there. One of the things that isn't really an indicator of whether you've got coronavirus is diarrhea. So if that's why you're buying the toilet paper, then you've no need to, honestly. But
Exactly.
but the main ones are...
And that's less likely.
The main ones are a new cough, chest discomfort and cough there. Yeah, that's written down as common. Breathing issues, certainly, because it is respiratory. Yeah. And, of course, fever. Again, a temperature of over 37.8 Celsius will indicate that you should take actions to isolate.
Yeah, and I point out someone earlier, I think it's Gene Smith 3, they said, Forest 13, how bad will the cases get in Florida? There's no real, real answer to that yet, because, you know, we don't have a test yet to know that, or let alone peak or anything like that, so we can't have a good, real solid answer for that, but, I guess the cases you could say would probably get worse within the next maybe month or two. Then they hopefully might start to recede after that. But that is, I guess, a mild guess you want to call that. But really, we don't know when it's going to peak or when it's going to continue on for the next couple of years. It's just a kind of hit and miss at this point with some. So that's what I was saying.
And just to confirm as well, for those with the thermometers, 37.8 Celsius is exactly 100 Fahrenheit. So if you're using a Fahrenheit thermometer, 100 plus.
Mm-hmm.
So let's reiterate how many cases we think there are right now in the leading countries. 80,824 in China is what I'm seeing here. 21,157 in Italy, 12,729 in Iran. The numbers will be different on my screen because this is the World Health Organization. It's out a little bit. I'm just looking elsewhere. South Korea, 8,086. Spain, 6,313. Germany, 4,525. France, 4,500 exactly now. Very interesting to note that in France there have been 91 deaths for the 4,500 cases, and in Germany only 8 deaths from 4,525. So that's a very interesting discrepancy. One that I don't think you can put down to coincidence, but I don't know what it is. In the US, just about to reach 2,500 with 55 dead so far. Switzerland is one of the worst countries per capita, 1,375 cases there with 13 deaths. Here in the UK, 1,140 with 21 deaths. Norway, also a very bad country per capita, 1,051 with 2 deaths there as well. And those are all the ones that are above 1,000.
Yep.
Yep.
And actually, this is kind of with the U.S. Actually, they just updated, and currently it's actually 2,570. So that's kind of a big jump, which is kind of shocking.
For what now? Sorry.
Mostly, for the U.S. United States, 2,572 is what I'm getting, and total confirmed would be and then total deaths 51 and total recovery.
It's very easy to put the magnifying glass on the numbers because we just don't know how quickly people are reporting new cases, or whether some organizations, some health services are pumping out those numbers in batches with their updates. So it's not fluid, let's say. It's something that will spike every day.
Yeah.
You get a better look on the daily level, don't you?
Yeah.
Exactly.
Yeah. All right. If there's any more questions for us, start your message with Force 13 all in text. There's not really that much you could ask about this, to be honest, because a lot of people are just watching and looking, and inconvenience for large parts of the world. but you can see how Europe's looking right now, not very good at all. Just to reiterate, special measures being taken in many of these countries. In Spain, it's virtually going on lockdown. In France, they are closing all non-essential public places. Italy's on lockdown. Poland, the Czech Republic, and Slovakia have closed its borders. Norway is closing its ports and airports starting Monday. And in many other locations around the world, there are strict features in place as well. A lot of places, of course, banning public events and gatherings.
And Nathan, New Zealand has decided to toughen up border security measures, especially anybody coming into the country by plane. They are now being requested to self-isolate for 2 weeks. And that's mainly international travel. So New Zealand has ramped up their protective measures, and we just don't know where it's going to end.
Yeah. And
I'm intrigued about the Southern Hemisphere, though, just to say, because you're coming out of summer now into the autumn-winter months down there.
And I was saying, whilst we're off air, that we're coming into the winter months, and it's going to be a breeding ground.
Yeah.
And we, the schools, we've got our annual school holidays coming up, but one of our health advisors said that there's no point shutting the schools down, because if any of the children were carriers and going into the local shopping centres or theatres, it could make the scene worse. And having them at school, well, you're controlling a possible spreading.
That's sort of the UK standpoint at the minute.
Well, I think that's a valid.
I mean, I wonder, especially if the countries, if you're going to close the schools, you're going to have to give the kids' parents paid leave, because otherwise the parents are going to work and they're going to send the kids off to the grandparents. So that's not going to go so well, is it?
And Nathan, sorry, mate, just picking up on your paid leave, that is part of the 22 billion package announced by the Australian Prime Minister.
I don't know if they're doing that here yet. I think the US in that announcement today was saying that as well, weren't they, Parker?
Yes.
Yeah.
Yep, they were.
So they are all starting to say it, so it'll be interesting to see if the UK does it. They may have done already, I've just not seen it, but I don't think so far.
So basically, with the paid leave, it's up to the employer, but the call has gone out for the business community to
the business community is going to get
provide. Yeah. But sadly, jobs
a lot of them
are being lost too.
The governments are going to have to help somewhere by the looks of things. You can just see how the markets are doing.
Yeah. Just before we go off the air real quick, I want to say that this around when we went off the air at around 4:30 Eastern Standard Time, the website updated, and they say now a new confirmed cases around 10.9 thousand. Now that could be off by a couple or so, but around maybe 10,000, if not 9. New confirmed cases now from around the whole world. So
today,
that's interesting. Interesting jump from 6.9, which we had earlier, to 10.9 now. 4,000 confirmed cases jumped. So that's very interesting.
Given the numbers that we had yesterday of 11,000, you'd be surprised if it was less than 10,000 today.
Exactly.
Quite honestly.
Exactly.
I think someone said anyone would stop panicking. Well, talking about panic, well, in my view, if you don't have the awareness, I mean, why we are panic, because we have high awareness of that. Why you see Europe has so many confirmed cases, right? Just people don't wear masks. Yeah, I see many reports saying that not many people just wearing masks.
You know something, in the local area, I haven't seen a single person wear a mask.
Yeah, that's good.
I've only seen one.
That's good. But
and it was an Asian person, but over here they're saying the masks aren't effective.
If they're not worn properly or something like that, I don't know. What I do know is from the World Health Organization, they say, I could tell you this one categorically, gloves don't help.
Oh, yeah.
But unfortunately, we're out of time for tonight. Thanks very much, everyone, for joining us tonight. Our team, David over there in Queensland, Australia. Parker joining us from Indiana, and Kenneth for the first time. Yep. Nice to meet you on the air over there. Oh, there's Parker. Hello. Nice to meet you on the air, Kenneth, tonight over there in Hong Kong. Yep. Well, that's it from here at Force 13 HQ, which thankfully is still virus-free for now. Let's hope that remains the case. Yep. And for yourselves elsewhere around the world as well. I think we're in for the long haul on this one. And we'll be back with more. I'm not sure when we're back yet, because tomorrow I think we're changing our programming, so look out for Force 13 on social media, which will explain when the next update is, hopefully with good advance notice. Facebook and Twitter, search Force 13, all in text, or the website force13.com. And if you want to get in touch, send an email to our email address, contact@force13.com. Good night.
Good night.